the JAMA Network.
Depending on how long little Juliano is in the hospital, he and his parents may see a number of different physicians. Communicating information about a patient's treatment is typically passed from one physician to another at the beginning and end of each shift. That's called a handoff.
Miscommunications during these periods of handoffs do contribute to these high rates of medical errors that we're seeing.
We had issues with written communications between doctors at change of shift, with verbal communications, just the training of doctors, them being appropriately oriented towards teamwork and communication in general.
Doctors Amy Starmer and Christopher Landrigan from Boston Children's Hospital and co-authors developed several interventions hoping to improve the handoff process. They examined more than 1,200 patient admissions involving 84 resident physicians on 2 inpatient units at Boston Children's.
The intervention itself consisted of 3 main components. We had communication training for the residents.
Once they got up to the wards, we had them use a new set of verbal techniques to transmit information in the same way every time.
And instead of residents and interns completing separate handoffs, a team handoff was implemented. In one ward, a computerized tool was also integrated into the existing medical record system.
The doctors would then be able to use the computer to type in key pieces of information that we didn't want them to miss during the handoff process.
The study appears in a theme issue on medical education in JAMA, Journal of the American Medical Association.
The rates of medical errors on the wards dropped off by about 40%. Rates of medical errors that injured patients in particular fell off by 50%.
We did not notice any adverse effects on provider workflow. They were able to still have time to spend with their patients, and the ways that they were talking with each other in verbal communication was improved as well.
This may mean better care for patients like little Juliano.
If hospitals work together and really develop these types of communication protocols, we think that really can lead to sustained improvements in patient safety and quality of care.
Catherine Dolf, the JAMA Report.